More than 25,000 Americans received a life-saving kidney transplant last year. It's a new record. If you or someone you know is waiting on the transplant list, there is hope in the way of what's called a kidney swap. We'll explain how it works and how it brought one couple closer than ever. Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. Alport disease is genetic. It can lead to kidney disease and ultimately the need for a kidney transplant. Joey Shagru has been battling this disease since middle school. But fast forward years later, and reporter Janine Kiesling shares how Joey and his new wife share way more than just a name.
Audrey Storm only knows Joey at his worst, suffering from failing kidneys. Still, it was enough to make her fall in love and give part of herself to see him at his best one day very soon.
I'm excited to just see him feel healthy and as he should be and not watch him suffer and just not have this looming thing hanging over us, wondering when and if it's going to happen.
Just ready to get it over with and see how I feel afterwards.
Newlyweds Audrey Storm and Joey Shagru are finally getting the wedding present they've been praying for. Joey suffers from a genetic condition called Alport syndrome. The condition allows blood and protein into the urine and causes gradual scarring of the kidneys, leading to kidney disease and, in Joey's case, kidney failure. Thanks to Audrey, Joey is getting a new kidney.
I think the exciting part is just knowing there's a light at the end of the tunnel, essentially.
Good morning.
Audrey wanted to donate a kidney to her husband, so she was tested to determine if she was a match. She wasn't, at least not to Joey. But that wasn't the end of the story.
It's pretty incredible. It was nice to know that's not the end of the road.
A kidney swap program is making it possible for Audrey to donate to another patient whose live donor wasn't a match for them, but was a match for Joey. 2 live donors, 2 recipients, making miracles happen.
And the Shagrus join us this morning. Joey and Audrey, how are you today?
Well,
Doing great.
thank you.
Feeling good? Back to normal?
Yes. Pretty much, yeah. Yep.
That is what we like.
Yeah.
That's better than ever. I love that. In spirit, I'm sure, for sure. Joining us here in studio is nephrologist Dr. Malika Gupta, who has been handling Joey's post-transplant care. How are you?
Hi, I'm good. Thank you for having me.
Nice to see them doing well,
Oh, yes,
correct?
definitely.
I bet. Okay, so Joey, just update everyone. How long has it been since the transplant, and just how are you feeling physically?
Yeah, so it's been about 3.5 months. Physically, just feeling a lot better. I used to cramp a lot and I was just exhausted all the time, but feel a lot more energized. And at a point in my recovery where I can start doing more physical activities like golfing and working out.
Audrey, same question to you. How are you feeling your recovery as a donor?
I feel great now. My day-to-day is back to normal. It took a while to get back to where I am now. It'll take a little bit longer before I can get back into some of the work I was doing before and this and that, but energy-wise and just normal day-to-day, I feel the same as I did before.
Dr. Gupta, let's just explain to people, what is Alport disease, Alport syndrome?
Yeah, Alport disease is essentially a disease of the kidney. So one of the structural constituents, or collagen, is made up of multiple chains, and these collagen make up one of the structural part of the kidney. So in Alport's disease, there is a genetic abnormality that causes formation of these abnormal collagen that can lead to abnormal kidney, essentially. So what, in general terms, what it means is the kidney is not able to function so well, and there is some leakage of protein and blood in the urine, and there is risk of progression where you may need dialysis or a transplant in the future.
Well, so that was my question. What is that progression to transplant? Can it be avoided?
Most of the patients who have Alport's disease, by the third decade of life, most of them have kidney failure. So once you are advanced kidney disease where you are about to start dialysis or on dialysis, kidney transplant is the treatment of choice. So most of the patient by the end of third decade, they need a kidney transplant.
So Joey, I do want to ask you, take us back into your teenage years. Tell us a little bit of the history and how this has affected your life, and kind of give us this journey to where we are today.
Yeah, so really just started noticing some changes in my urine output when I was, a teenager. I knew my mom had some kidney issues, and so I went and saw a nephrologist and didn't really think much of it until I moved down to Kansas City, and it started progressing more in my 20s, my mid to late 20s, when I had a biopsy, and it's just physically has made me pretty exhausted. So, doing anything outside or, walking a dog was a challenge at times, but feeling a lot better now.
So, I mean, when young couples meet each other, they're usually not going through health issues together. So you meet Audrey. How did you explain that, the fairy tale hasn't quite started yet because you're still in the zone?
Yeah, I mean, I just kind of let her know, like, hey, I just recently found out I have this disease called Alport's. Not sure what the timeline is, but it's probably going to end up in dialysis or transplant. I don't think at the time we actually knew that transplant was going to be a situation coming up as soon as it did. But she was, very understanding and supportive and never wavered.
So Audrey, any hesitations when you knew that you could step forward and be tested? What was that experience like for you as a soon-to-be donor?
There really was no hesitation. It was always going to happen to make sure that I got tested, because if I could be the one that could make him better, I would absolutely do that, no questions asked. I did as much research as I could to just understand it, because being someone who didn't know anything about kidney transplants, it was a little daunting. But there's so many resources out there that helped ease my mind, and once I knew more about it, it just helped me just be so prepared to do this.
Sure, doing a lot of research. Dr. Gupta, Audrey was ultimately not a match for her husband, but she was a match for someone else. So let's talk about the paired exchange program. We often call it a kidney swap. How does it work? And just kind of explain that process.
Yeah, so like Joey and Audrey's case, so if the direct donor is not a match, be it for blood type or other reasons, there is a program called kidney pair donation where you can enroll. So just to put it in lay terms first, so imagine if someone has an iPhone and someone who wants to help has an Android charger, and another couple have an Android phone and an iPhone charger. So, but they're not direct match to each other, but you can switch and help each other out. So that's essentially how the kidney swap works. So if there are one or more pair of donor and recipient who aren't matched for each other, we pool them, run an algorithm, and see if we can match them between each other, and that's how it can help more than one person, and every person donating and a recipient receiving a kidney.
And less waiting.
And less waiting,
on
for
lists.
sure. Yes.
What's it like when you tell a couple who, Audrey comes forward to give to her loved one, and that's kind of what she has in her mind, but then you present this opportunity to say, hey, you're going to donate to someone you've never met before. Mm-hmm. What is that like, kind of counseling couples through that?
Yeah. So I think based on the experience, we say it goes successfully and smoothly, and that's the data we can base our decisions on. So it goes pretty well so far in our program. We have done multiple chains before, and it's not a new thing. It's been happening nationally. There is a provision where you can even do the swap between different programs nationally. It's called like a national kidney swap. And counseling, I think there are a lot of resources resources, as Audrey mentioned. There are multiple websites. There is an American Society of Transplantation Living Donor Toolkit, which is available online for donors. And there's a lot of resources about financial stuff that donors have to go through, and medical updates and all those things. So there are a lot of resources, and we are always here for help. So,
Joey, Audrey, what was that like, just kind of navigating through this idea of a kidney swap?
I think we were fully prepared for it, and had heard about some longer chains of like 10 or more people in Texas before, and just very excited by the opportunity to get into the program.
Yeah, absolutely. It was great that there was another option for us, knowing that that wasn't the end, and to have that opportunity to have 2 people come out with a new kidney that they needed.
Absolutely. You both were married last summer. You honeymooned, but Joey, you were in kidney failure at that time. You spoke earlier, though, to us about kind of better future trips in the future.
Now it's just saying yes to most things, and doing as much as possible, like going to the lake with her family and going to Florida, going to my friend's wedding in August, and we planned a trip to the Bahamas in January.
Taking a look at the calendar in the months ahead and just knowing that we're going to be able to participate in whatever it is, weddings, out-of-town trips with family, things like that.
Yeah, that must be nice. Something we take for granted, being able to actually plan things out and know that you're going to be well enough to do it. This question is for both of you. Audrey, get us started, but what lifestyle changes have you had to make since the surgery?
Nothing too major. It's really just been kind of slowing my pace more than anything. Just getting back into the swing of things, getting my energy back, getting my strength back. But more so anything, it's just perspective that's changed. Just seeing what comes out on the other side, and just trusting that this was all going to work out, and just being so grateful to have this opportunity.
Yeah, perspective. Very, very cool. Joey, what about you? Any changes you've had to make?
So towards the end before the transplant, we had made quite a few lifestyle changes to just try to extend that time as much as possible. Eating a balanced, healthy diet. Biggest thing, not eating any raw or undercooked meat, unwashed fruits and vegetables right now. But now that I have that additional energy, trying to do more physical activity outside with our dog, going to the gym, just doing whatever I can to make sure the kidney has good longevity.
Dr. Gupta, take us back to surgery day. Kind of explain the logistics of a kidney transplantation, from the donor to the recipient. How does it all together? What's the timeline? How long does it take?
Yeah, so I think it all starts with the recipient coming through our program and getting evaluated for a kidney transplant. And once the recipient is approved that they will benefit from a kidney transplant, they get listed, and that's how the donor process starts after that. So whoever potential donors are known to the recipient, they call us and get evaluated. So lots of testing for the donors. I would say within like couple of months at least, that's how long the workup goes. Once everything is matched and all the blood tests are run, then we plan on an elective date of surgery. During the morning, it's pre-op, and then anesthesia, and then surgery, and then post-op, and come back to the floor. That takes around a day or so, the whole thing. And then usually hospital stay requires 3 days for the recipient, 2 to 3 days for the donor as well. And then just clinic follow-up after that for both of donor and recipient. It's more intense for the recipient though, post.
And it's been said that once a recipient gets their new kidney, that it starts working pretty instantly, and they start feeling better very quickly.
Yeah, if everything goes well and the kidney starts working, it starts making urine essentially at the time of anastomosis, meaning at the time of surgery, and the patient will start feeling better day one, essentially. All the energy is back and all that. So essentially day one.
Yeah, Joey, I see you shaking your head. So is that accurate?
Yeah, no, and I immediately felt warmer in the hospital bed afterwards. But yeah, I think Audrey was kind of upset at me because she wasn't feeling as great, and I was like, I got this new kidney. I'm feeling wonderful. But no, she was happy for me.
Yeah, I'm sure she was. Yeah, they say you don't really know how sick you are until you get that new kidney and start feeling really good. It doesn't take a lot. Dr. Gupta was talking, Audrey, about that intense evaluation that you go through to make sure that you're healthy enough to donate. What was that like for you? What surprised you going through that? How intense was it?
I didn't really let it surprise me just because I tried to prepare myself as much as possible just to not be caught off guard by what I was getting into. I'm not great with needles and blood work and things like that, so that's something I had to power through because there was certainly a lot of blood work. But it was a lot of just conversation too, making sure I was mentally able to make this choice. And it was something that I wanted to do on my own, not being forced into it and things like that. But it was great to get a clean bill of health and be able to be healthy enough to save a life.
Yeah, that's good news. Dr. Gupta, what makes for a great kidney donor? For those listening who may want to research and look into donating a kidney, what are you looking for?
Yeah, so a healthy donor, non-smoker, non-diabetic. I think if you are healthy and have 2 kidneys, it's safe to donate a kidney. So essentially we choose the donors who are very, very healthy, where losing 1 kidney is not going to affect their life. So people who are healthy, non-smoker, non-diabetic.
Joey, Audrey had mentioned just, taking every day is a new day and not taking anything for granted. What's the biggest change for you mentally through all of this?
I mean, not having this, dark cloud kind of looming over everything that we do, that's been very helpful. Getting a new kidney, you just have a lot less brain fog too. So more literal, just being able to think clear, be more present and day to day, and being with my wife and our dog, and yeah.
So Dr. Gupta, Joey has this new kidney. So where does his Alport syndrome stand at this point?
Yeah, as I previously mentioned, it's one of the constituents that's abnormal, the collagen 4. But that collagen 4 is present in some other organs as well, so eye and ear. So we haven't done really anything to those, so those still exist. But where it matters was the kidney, and he has a new kidney now. So the essentially old kidney just shrivels up and stops working. So we don't worry about it still being there too much in terms of kidney.
But will he still be treated for Alport syndrome?
No.
No, done. That's in the clear. That is good news. Be sure to ask your questions to any of our guests today. You can use the chat on YouTube, Facebook. You can tweet us. Email us at the Medical News Network. The info is right there on your screen. Let's get a check-in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. How are you?
Hi, I'm doing pretty good. Yeah, we don't have a COVID count today. Again, we were transitioning, so we're kind of waiting for some of the higher-ups to be able to get us our numbers for acute infections or active infections. But if you remember the last few weeks, certainly we've had under 10. We will get those and present those probably Wednesday for you. So. All
right, sounds good. But I do have a question for you. So another new COVID variant out there. The World Health Organization has asked countries to monitor, I got to take a deep breath, BA.2.86. One headline calls it highly mutated. So we're just talking about the other variant, EG.5. How is this new BA variant different?
Yeah, again, I think we need to expect and understand that we are going to see variants continually now as we are living with SARS-CoV-2. This is nothing new. We do know overall our surveillance around the world has decreased, but there still are surveillance mechanisms. And what this one is, this is on the surveillance mechanisms at a couple different countries. They have found that this new variant is worth monitoring, so it's a variant for monitoring. It seems to be a lineage, again, of Omicron, but maybe had originated further back than from where this most recent one that we've all heard about, the Eris, originated. There is a concern because in this newest one there are more spike mutations, over 30. But again, we don't know exactly what that means. Certainly we know that it can evade the antibodies, but we still have our T cells to help provide protection against hospitalization and severe disease. And overall, there does not seem to be anything fundamentally different with this variant compared to others. There is a very low amount of circulation, but they are monitoring it. Again, right now the Eris, the EG5, still continues to be the more dominant variant in the United States and around the world. But it is worth monitoring, and I think that's good that we are continuing to do that, having those surveillance mechanisms there as well.
See, we still need to keep you around. Keep us updated.
Right.
All right, Doc Ock, thanks so much. Any reporters with us today? Well, let's get to some good viewer questions. Yen Liang wants to know, do patients who undergo kidney transplantation need to take immunosuppressive drugs for their entire lives? Dr. Gupta.
No, for the life of the kidney. So, yeah, but there are new studies actually happening, which is very interesting to learn about tolerance, because some patients develop tolerance to the new organ. But those are not for prime time yet. So for right now, you need anti-immunosuppression for the life of the kidney.
Another question, is it possible to use swine kidney to replace human kidney? What's up with that?
Also, that's a very good question. The patient who got this experimental pig kidney actually died last week, but he survived for a few weeks, I think. The pig kidney actually worked right away, but as I said, it's all experimental, not ready for prime time yet. There are extensive research happening about that, so I think not so far in the future, but not ready
But
yet.
not ready. Not ready for prime time. I like that. Question is, just what's the difference between a living and deceased organ? Are we doing more living? Living clearly better for
Yes.
longevity, but
Yes.
so are you, how often are we using deceased organs when it comes to kidney transplantation?
Yeah, so in general, the average percent is 25% of all the kidney transplants we do are living donors, so 75% are still deceased donor, and that's a number for nationally as well. I think that's pretty reflective of the national average too. Living donor outcomes are better, as you said, because there is less traveling time of the kidney, less time spent on ice, so less cases of injury and
Repeat
so forth.
that percentage. You said 75%
Is deceased.
still...
So deceased donation around 75% and living donor around 25%.
How do we educate more, do you think? What would you like to see happen so that people have a better understanding maybe of what the Sugars just went through and how these happy endings turn out?
Yes, definitely. I think it definitely helps if you know someone who's suffering through that and has a kidney problem. I think if you are in that, you're hearing about that, then you explore more and research more. But otherwise, I think we have a lot of drives which should have more mass effect, but they don't. I feel like that's where we can work more. But whoever is interested in doing so, there are a lot of resources, as I mentioned previously. American Society of Transplantation has a donor and a recipient portal as well, so lots of information there.
Joey, you had mentioned your condition being genetic. Does anyone in your family have this condition or have been have to travel down the transplantation road?
So my mom and sister both do, but have not had to go down the transplant road because it does affect women differently than men and less severely.
Let's talk about that. Why is it? Why does it affect women more than men, or differently?
Yeah, it affects men more because the chromosome that it's transmitted through, males only have one of those chromosome. So in the XY, the X is coming from the mom, but that's manifested more in males, whereas females have 2X and X. So that's half of the chromosome. So that's why it's little less severe in females. That being said, there are other ways Alports can be passed down the generation, which could be more severe than the X-related.
Interesting. A couple of personal questions, Joey and Audrey. First of all, you mentioned your vacations. Somebody wants to know, where's your next one planned to?
Bahamas. Yeah.
Oh, nice.
In January. Yeah.
Nice. Another question, and if you don't want to answer this, that's fine. But Jean wants to know, are you planning on having any children? And is that something you've been counseled on as far as the genetics go? And you know, does that affect them in any way? So I'll let you both speak first.
Yeah, that's something we are planning for in the future. Pretty much the restrictions that I was told was wait a year until after the surgery so my one kidney can kind of figure it out and be prepared for the pregnancy. So sometime next year we'll start having those conversations, and then I'll just have those conversations with my OBGYN, and it sounds like everything will be fine.
Perfect. Then we'll have you back on and we'll meet the baby. We like that. A good where are they now? Does that sound about right? Is that the advice that you give to young couples like this that, you know, have gone through this and need to also expand on their family?
Yes, for sure. So I think the type that Joey has probably, it's not very likely that the kid will have that. That being said, Audrey has been a donor, so there is some risk for Audrey, but 1 year post, usually that's when we recommend getting pregnant for donors, 1 year post-donation, and there is some risk, but it's manageable. And as I said, all the donors are pretty healthy, so they can deal with the...
Right, they could take it on. Just last question, what about genetic testing? Is there any reason to test for this? If you had a parent, is there something that should you test so that you can kind of get ahead of it?
For general population? No, there's no reason to test for looking for diseases, only if you have symptoms. So as I mentioned previously, if there is blood in urine, protein in urine, blood pressure, or someone said your creatinine is high or stuff like that, then you need genetic testing. Otherwise, no.
Okay, good to know. All right, let's get our takeaways today. Joey and Audrey, what do you want folks to take away from your personal story?
Yeah, I mean, there's just a lot of people out there that are in need of organ donations, especially kidneys. I mean, the wait list is long. And so just want people to know, you know, you can live a perfectly healthy life with just a single kidney. And someone out there would be forever grateful for that gift of life. So
thank you for that message. Audrey, what do you want to add?
That's really it. Just knowing what your body's capable, if you are able to save a life at the cost of some short-term discomfort and to just come out on the other side just the same as you were before, it's a no-brainer.
Well, as we always say, we can't educate without our patients coming forward and sharing their stories. So we appreciate you sharing this with us. No joke, we're going to track you down and bring you back on. We want to know where you guys are here in the next year or two, okay?
Yep.
Great.
Thank you both. Dr. Gupo, what's the takeaway today?
So as Joey and Audrey said, I think there are so many people who need a kidney. There are around 120,000 patients in the U.S. who are waiting for an organ, around 100,000 waiting for a kidney. So if you're healthy and could be a donor, I think it's a very worth idea looking at, and you can lead a very healthy and safe life even after donating.
Yeah. So. That's a big gift to give, but very worthy. Thank you, Dr. Gupta, for sharing today. Thanks to all of our guests and our viewers for being with us today. We will see you back here on Wednesday. Coming up Wednesday on Open Mics with Dr. Stites.
We all know about COVID, but there are other infectious diseases that keep the specialists awake at night. I'm Alexis Del Cid. On the next Open Mics with Dr. Stites, Dr. Dana Hawkinson shares what he's watching worldwide and here at home to keep us safe, along with the other healthcare professionals working together to guard against the next pandemic. Wednesday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.